Be brave, speaking up. That is what our members and our union have been doing since our last convention. And that is what we will keep doing this week. Our theme is taking care, giving care. The minister said giving care is what we do, and it certainly is what we do best as registered nurses, whether it be in a hospital, a home, or community, or the many other areas in which RNs work across our great province. But what we're not so good at is taking care of ourselves and each other. Some people say to me that our healthcare system is broken. Well, you cannot fix a broken healthcare system with broken providers. We need healthier, safer workplaces. And this week, through our discussion and debate, that we will set the stage for the work that our union will do in these two areas. I'm excited this week that we have 82 first-time delegates with us. And I'm going to ask them to stand, please. Stand up. So all the first-time delegates. Now, I know they all have sunglasses, so I'm going to ask you to stand up again. Don't sit down yet. Put your sunglasses on. They all got new RNU sunglasses last night. So all this week, they're going to be wearing their sunglasses. Probably not on their eyes, maybe on their head or attached to their name tag, so they can be identified as first-time delegates. And us spicy delegates, those of us who have been around the block a few times or even more than once, can make sure we give them the welcome that they deserve this week. So welcome. Hope you enjoy your week. I'm also really excited that we have nursing students with us this week as well. Students from Western School of Nursing, Munn School of Nursing, and the Center for Nursing Studies. Would you guys stand up? Okay, at the back of the room, up here. Some of them obviously not here yet. And we're especially privileged this week in that we have board members from the Canadian Nursing Students Association, the Atlantic Regional Reps. They're having their Atlantic Conference in St. John's next week or on the weekend. So the students came early, the board reps, and they're joining us for this week. So they're up here. Brandon and Letitia, would you stand? Aaron. Thank you. The students, you are the future of our profession, and you're also the future of our union, by the way. We want you here so that we can sort of get our hooks in you, so that you take over for some of our spicy people when we want to move on. And you have such a great opportunity this week, because you are in the room with over 200 of the most amazing, dedicated leaders that this province has. And you will see them in action this week. So you will learn from the best in Newfoundland and Labrador. And I want to thank the leaders in this room and those who can't be with us today across the province for all the work that you do on behalf of registered nurses. I know that you work in very challenging environments. And you don't have to do this. You don't have to take this on, but you are taking it on, and you have taken it on. I remember when I started as a shop steward over 35 years ago, I remember what motivated me, and it was because I wanted to make a difference. And I want to assure you today, all of you in this room, that you are making a difference. You work very hard to make sure that you are engaged with your members. It's the one thing when we get together, you're always talking about, how can we engage our members? How can we engage our members? And you're always trying to build those connections. And that's a priority for us at the provincial level too. And no matter how much we do, there is always more to be done. And, for example, at every Council of Presidents meeting, and we meet with our branch presidents once a year, and every one of those meetings we have discussion around engagement. And our presidents sign a branch president's pledge of engagement in that they pledge to take one tool, and they identify what that is, one tool back to their branches that they will implement in an effort to improve engagement. Some of them are embracing technology. And just last week, I attended a Branch 3 meeting while sitting home in my living room because they were doing their meeting via Facebook Live. In fact, today, this presentation is being done by Facebook Live. So our members from across the province can be listening into my presentation. I'm using Facebook Live more and more often as well. The last time actually was on Monday evening when we did a short Facebook Live session from our board meeting, when the board was meeting to dot our I's and cross our T's and make sure everything was prepared for this week. It is a great way to connect with members outside of having to have them in a meeting space. I do have my phone in my pocket, and now it's prompting me to hold up my phone, so here it is. So reality is that young people and our younger members and our students who are in the room, this is how they're doing their work, and they're talking to people. They're talking to their friends on it, they're doing their banking on it, they're doing their shopping on it, they're keeping track of their prescriptions on it. They could even be talking to their physician on it, for all I know. So we as unions have to get much better at how we use technology to connect and engage our members. And we have done that as an organization, and we, a couple of years ago, we said, okay, we have a nice fancy website, it needs to be updated, and we said, it's time for us to get a little bit more in tune with technology, so we developed our RNU app. And we know our members are engaged through that app. And the number of downloads, we're at, I think now, up to 3,000 of our members have downloaded the app. I mean, that's amazing. And it allows us to connect, no matter where our member is, they take out their phone, hit the app, and they can have the latest information about their union. That's pretty awesome. But engagement, we have to find a balance. It can't all be about technology. We also have to have that face-to-face contact as well. And it's one of the reasons why the board has set as an objective for the next couple of years that a member of the provincial executive will visit every branch in our province to have a face-to-face meeting. We also want our members and our volunteers, you, to be better identified in your workplaces. How do your colleagues know that you are the shop steward for the unit, or you are a member of the branch executive? So before you leave this week, you will receive cards that you will attach to your ID that you wear to work that will identify you as a shop steward, a branch executive member, or a board member, so that our union and our leaders are visible in our workplaces. But engagement is more than just about branch visits and meetings. It's about ensuring that the voices and perspectives of all of our members are heard. We have a statement in our vision statement that says we value diversity. Those are very powerful words. Just 2 words, they're very easy to say, we write them, but we also have to mean them. I attended a Human Rights and Equity Day, an Education Day, at the Ontario Nurses Association annual meeting about 1.5 years ago. And throughout that day, ONA shared with their members the work that they are doing to promote equity and diversity within workplaces and also within their union. And they talked about equity for all workers, including members of Aboriginal descent, including members with disabilities, lesbian, gay, bisexual, transgender members, and racialized members. It was just a powerful day. And I realized during that day that these were conversations that our union needed to start having because we had not had them. We have that statement, value diversity, in our vision statement, but how are we really showing that to our members? And I'm so delighted that we are starting to show that tomorrow. We have some awesome panels lined up for you, and I can't wait to hear what our members have to say, what our patients have to say about diversity in our healthcare system. And then on Thursday, we will debate a resolution that will allow us to move forward with an action plan to make sure RNU can be as inclusive as we can be, and that we just don't say the words value diversity, that we actually mean them. We've also shown diversity in the last few months in terms of our involvement with the labor movement. I was so excited in May at our board meeting when your board of directors made the decision to join the Federation of Labor. And we are now members of a diverse labor organization. I went to my first executive council meeting last week, and I sat around a table with leaders from the private sector, public sector leaders I talk to very frequently. But I know nothing about the struggles of workers in the private sector. And I sat around the table and heard about the struggles happening with carpenters and millwrights, what's going on and how it's affecting workers in Muskrat Falls. A rep from CUPW talked to us about the struggles of postal workers and their rotating strikes that are happening in the country. It made me feel so good to sit there on your behalf and lend them our support as registered nurses, but also to make sure I understood their issues so that I could speak more, firmly when I'm talking to my friends and my colleagues and other people around why people, are struggling in one sector or another. Our voices need to be at that table. And the one, Hassan said it in a speech this morning. We're stronger when we're together. And it's not that we were never together with the Fed, because we worked very closely with the Federation of Labor before we became members. But I guarantee you, we will be stronger, and they will be stronger because now we are members. And I've seen examples of that just in the last couple of weeks. One of us is around presumptive legislation for mental health injuries. This has been a priority for RNU, and we've been lobbying government, and we speak to ministers whenever we have the opportunity to make sure that they move forward on presumptive legislation for all workers, for registered nurses and all workers. And the Federation of Labor in the last number of years has been lobbying and doing their work on that regard as well. All of us sort of pushing in the same direction, but now that we're members, we'll really be rowing all together with the same oars. And just a couple of weeks ago, if you were following what was happening in the media, you probably saw that labor leaders learned that the Employers' Council were lobbying behind the scenes. They were having meetings with ministers and cabinet and MHA saying, don't listen to those bad unions, what they want in terms of presumptive legislation. No, you have to listen to us because we know what's best for workers in this province. And, their solution, I think, was to tell government do nothing. So the labor movement engaged. And we started, social media tweets and Facebook, and NAPE was out with their campaign, and they turned up the heat, and Mary turned up the heat, and all of us together turned up the heat. And that voice now will be stronger because we're turning up this heat as members of the Federation of Labor. I did invite the the executive director of the Employers' Council is Richard Alexander. How many people have heard that name in the media some of you have heard him, well, I invited him to come to our convention tomorrow, to sit in on our panel tomorrow afternoon and hear the stories of registered nurses. And maybe once he heard real stories from workers, he would change his mind and he would join our voices in asking for presumptive legislation now that covers all workers for mental health injuries. I'm not sure he's going to show up. Another example this week, which again told me the power of the voice of the Federation of Labor, is on domestic violence. And Hassan mentioned this morning as well. And we were at our executive council meeting when our president, Mary Shortall, had a message from someone in government to say, government is proceeding with domestic violence leave. The provincial government is proceeding with domestic violence leave. 10 days of leave, 3 days of which will be paid leave. And that, if I had one little iota of doubt, it wiped that away in terms of the value of our voices being at the table with the Federation of Labor. I saw firsthand the work that is happening and the tremendous work that is being done by that organization, and we're now be able to put our voices with the rest of the thousands of workers in this province to make sure that we not only share the voices of our members, but we're also putting forward strategies that will help all workers in Newfoundland and Labrador. And while we're on the topic of violence, I can't leave that topic without talking about violence in healthcare. Violence, physical violence, sexual violence, verbal violence. How many in this room have experienced violence in your workplace? Some form of violence in your workplace. Hands up. Man. I'm not surprised, but when I actually see it from this perspective, that is really overwhelming. Stats from Workplace NL show that nursing providers, RNs, LPNs, and personal care attendants make up 58% of workers who are injured by assaults and violence. 58%. In contrast, police officers make up under 2%. I'm so proud of the CFNU, the Canadian Federation of Nurses Unions, and our president, Linda Silence, for taking leadership on workplace violence at the national level. And CFNU has just launched a toolkit and a petition, and I know Linda will talk to you about that in her address on Thursday. Violence is not part of our job. And you know what? Violence is not a registered nurse issue. Violence is a healthcare issue. We have been advocating for a provincial task force on violence in healthcare. I haven't convinced government that they have to do this yet, but I guarantee you I will not stop sending that message to the decision makers in this province that we have to do something to make our workplaces safer. It is unbelievable to me that for me to go to visit an MHA at Confederation Building, as of a couple of weeks ago, I have to put my purse and my bag through a metal detector like at the airport, and I also have to walk through one of those scanners. They are protecting, rightly so, I assume, the people who work at Confederation Building. Well, when are they going to protect the people who are working in healthcare? Making our workplaces healthier and safer is, our number one priority. And we can't talk about that without talking about workload and staffing. We have to tackle the issue of safe staffing. I'll talk a little bit about the minister, what he didn't say or said, when I get to some of the issues around the questions. But we have to start talking about this. And we are talking about it, and we'll keep talking about it. Again, a few questions for you. How many of you in this room think your workload is too high and you're being pushed to the limit? How many? How many of you think staffing is not safe for the patients you care for? How many of you have worked 16, 20, or 24 hours straight? Wow. How many of you have finished your shift and went home and thought, I wonder what I forgot to do? And how many of you had cried during your shift or while driving home out of sheer frustration? That is sad. It is sad to see that many hands put up for all of those questions. What does that say about the health of our healthcare system? And what does it say about the health of registered nurses? For example, why are we still fighting a staffing crisis in Goose Bay? Last year, government and Labrador Grenfell spent $1.5 million on agency RNs in Goose Bay alone because they didn't have enough staff. We asked our members to describe how they feel when they're at work. These are the words that they used: anxious, frustrated, stressed, defeated. These RNs are caring for laboring moms and newborn babies. They're caring for acutely ill people in that facility. And they're feeling defeated? The question was asked the minister about what government is going to do about this, and he referenced the committee that is being set up between the employer and RNU and the Department of Health. And you know what? We've had these conversations many, many times before, and I look to Gordon and Vanessa, who are here from Goose Bay. I can't tell you the number of times we've started and tried to address the staffing issues in Goose Bay. This time, for the first time, we have the attention of the Department of Health. I am hopeful that that will make a difference. But I can guarantee you something has to change in Goose Bay. This committee, there is no choice here. There is no option to say, well, it didn't work, because that can't be an option. It can't be an option for our members up there on that inpatient unit, the RN with the most experience, having 2 years of experience. Can you imagine? They're bringing in new grads and they're being mentored by people with, some of them, less than 1 year experience. No wonder they're leaving the area as fast as they can get out of there. Goose Bay is not the only area in crisis. Burgeo, critical staffing shortage. I want to share with you some words written by an RN who works in Goose Bay, or in Burgeo. I have been a registered nurse for 24 years. I am at a crossroads. I have 12 years left until I can get my pension, and I simply don't know if I can last that long. I am mentally spent. I am physically spent. I question if it is work that is going to break me. How sad that makes me. How angry that makes me. Long-term care. The question from the minister sounded like to me he didn't really think we had a big problem in long-term care. Seems like the hours of care are fine. He's not getting the message. The hours of care are not fine. If you watched the media yesterday, you saw a concerned group of citizens presented a petition to the House of Assembly with over 2,000 signatures on care in long-term care. The minister, I guess the one positive thing I think he said in his comments was that we have some new long-term care facilities opening, and it might be an opportunity for us to look at the staffing in those facilities as we move forward. Well, I say yes to that, but I also say yes, we got to look at the staffing in the facilities that are currently in place. "24-hour shifts. Pediatric ICU, 28 24-hour shifts since August. The case room. I've lost count how many 24-hour shifts the case room are working. St. Anthony, and I could go on. These are just some of the areas where registered nurses are working 24-hour shifts. I think that tells us we have a staffing problem. And every time I talk about 24-hour shifts with anybody who has a power to make a difference, they say, oh, that's terrible. That can't happen. How can that happen? We'll make sure that never happens. It's still happening. And we know, as registered nurses, that we cannot provide safe care at hour 23. It's impossible. We are tired. We are stressed. We might not have eaten. We haven't slept in more than 24 hours. How can we provide safe care at hour 23? Double overcapacity, triple overcapacity. Soon it'll be quadruple overcapacity, and I don't know what they call it when it's 5 times overcapacity. So I guess they'll come up with a term for that. But I mean, they just keep adding new terms because it's getting worse and worse. I don't see any solutions so that we're getting back to us never having overcapacity, ever having to be called. Facilities operating at 135% occupancy. And we all know you're staffed at about 80 to 90%. No, I think we should put in our collective agreement we buy people roller skates or skateboards or something. Because we're not seeing the real solutions happening around how do we address all of these staffing challenges and workflow challenges in our system. And it's not just acute care and long-term care, it's also community. It's also, by the way, our schools of nursing who are challenged around workload. Workload is an issue no matter where registered nurses work in our province. So how many of you in this room think that more full-time RNs can save a lot? Yeah, I didn't think I'd have to convince any of you. We have provided the evidence to government and employers. We have told all the stories. And you know what? Doing nothing is not an option. We have to stop staffing based on a budget, where the employers are given so much money and they're told hire out of that. We have to stop staffing based on the number of beds that might be on a unit. We have to start staffing based on the needs of the patients in the beds. And that's where our call for a core staffing review comes from. That we need to make sure that we have enough staff to care for patients' needs. You know, you might have 10 patients in the bed that they are all walking around. Now, this doesn't happen in our system anymore, but you know, it used to. They're all up and about doing their own care. We all know that one RN could probably look after those 10. Or you could have 10 patients in those beds and you need one-on-one care for every single one of them. Staffing is dependent on the needs of the patient, not on the numbers of beds. This is a priority for us. If you haven't heard me say it before, it's because you haven't been listening, because I say it over and over again. This is a priority for us at the bargaining table. It's a priority for us in every meeting we have with every minister. We have presented, and the minister alluded to this in his comments this morning when he talked about the workforce management system. He didn't present that very well, in my view. So government, about 2 years ago, put out a request for proposals for a new workforce management system, which is a technology-based system that would help with staffing and many other areas and programs. And through our education and lobbying and educating the minister as well as the regional health authorities about the New Zealand staffing model, which is based on patient acuity. As a result of all that education and lobbying, government changed the request for proposal and added an addendum. And that addendum was that the vendors, the people who bid, had to make sure their bids included a system that would have the capacity to do a staffing model based on patient acuity. That was our first victory, in that whatever system they bring in, that the technology will have the capacity to do the staffing model based on patient acuity. I did not hear the minister say, yes, this morning we are going to do a staffing review based on patient acuity. So obviously our work is not quite done on this. And it certainly is within the minister and government's control to make this happen. And we will keep advocating for a core staffing review. But in the meantime, we have to keep documenting. I know it's the word sometimes that you really don't want to hear. More professional practice forms, more occurrence reporting. You're tired of filling them out. And I realize that people are tired of filling them out. But you know what? All of our advocacy is strengthened by the data that you give us and by the data that you give your employers. When you document, you are arming us with evidence. So it's really important. And also, it's not our choice of whether we document or not, because it is our professional responsibility to document. If we see something happening in the workplace, and if it is staffing related, then it's our obligation as a registered nurse under our standards of practice that we identify that risk to the employer, that we advocate on behalf of our patients to the employer. And you know what? Our patients are depending on us to do that. They have no idea that their care is being delayed because you're down 1 RN today. They have no idea that something was left undone because you were down 1 staff member today. They are depending on you, who are the experts, to document that and have conversations with your employer about that. You can't make the changes, but it is our responsibility to identify those concerns to our employers. This has been a priority for us at the bargaining table, and by now you're probably aware that we have made some improvements to our professional practice language at the table. One of the first things we wanted to do was make our process non-confrontational. Professional practice is not about we and they. We as the RN is not against their manager or not against the employer. In a professional practice situation, we are identifying a concern and we want to have conversations with the employer about it. So our language is non-confrontational. We've also built in timelines for responses, because I know one of the frustrating things is you put in a form and you don't hear back in terms of whether there was any change or whatever. So now there will be timelines when responses will be given. And we'll also in the future have a provincial form, which will help in terms of continuity of the process from one employer to the other. Now, up to this point in time, we have not been successful in convincing employers that they need an independent assessment committee. But we haven't given up on that initiative either. We're still going to push that at the bargaining table because we do believe it will help the process. And while there's so many challenges in our workplaces and so many areas that are under so much pressure, we also have to acknowledge the successes that are being made and the improvements that are being made as a result of the advocacy work that is being done by so many people in this room and other registered nurses across the province. Branch 23, Stephenville. They filled out form after form after form in relation to inadequate staffing on their surgery unit. It took them a while, but finally the employer increased staffing on surgery. Well done. St. Clair's, endoscopy. Again, long time, form after form after form, talking about it, PPC meeting after PPC meeting. But eventually, the data piled up, and the employer not long ago made a decision to increase staffing in endoscopy at St. Clair's. Well done. And I mentioned Burgeo earlier, who is in a staffing crisis. And I want to acknowledge the work of our branch president in Burgeo, Glenda Dollamont. Glenda, I'm looking for you in the room. Can you, now I'm really gonna ice, okay, there you are, and she's gonna hate me for that. But I do want to acknowledge this passionate, compassionate leader who has been like a dog with a bone, advocating on behalf of RNs and really all staff and patients in Burgeo. Now, for some of you who don't know where Burgeo is, it is in the southwest corner, on the southwest corner of Newfoundland and Labrador. About 2.5 hours, 3 hours from the Trans-Canada Highway, driving down a very isolated road. And that area has been desperate for staffing, to the point that Glenda, almost wasn't able to meet, to be able to come to convention. But Glenda has been relentless in her advocacy with her manager and employers. And along with our staff member, they have been meeting and, bugging the daylights out of people, to the point where the employer agreed to post 2 temporary full-time positions for the Burgeo site. Now, Glenda told them, we told them, that they're not going to recruit anybody for temporary full-time to go to Burgeo. We said they needed to be permanent. So, of course, did they listen? No. So they posted the positions. There was not one applicant. So now Glenda and her LRO and the staff are still at it. They're advocating now for them to be posted as permanent. And we won't stop until those positions are posted as permanent, so staff in Burgeo get some relief, because they're at their, when you're at the brink, they're holding on by their fingernails. So thank you, Glenda, for all of your advocacy work on behalf of your members. And that's a standing ovation for all of you in this room. We are the trusted voice of health. Registered nurses are the trusted voice of health. We hold the public trust. The public trusts registered nurses. Elaine mentioned that in her comments this morning. The public also trusts RNU. The public get it. They know more full-times RNs can save a lot. They see the workloads and the challenges that you're facing within your workplaces. I was at a meeting last week, and a senior government official was there, and he's pretty new to his role. And he asked me a question. He said, Debbie, if you could prioritize, what would be the 3 main priorities for your members? And without missing a beat, I said, workload, workload, workload. 1, 2, 3. And I have set for myself 2 personal priorities for the next 12 months. First, I want to stand up to my members and announce that we have a collective agreement that will improve RN workloads going forward. There has to be something in our collective agreement that will make a difference in terms of the workplace and workloads that every single RN in our province is experiencing. Second, I want to make sure that RNU and our members do everything in our power to make sure healthcare is a priority in our next provincial election. We must use our value and the trust of the public to make sure our voices are heard. We must stand up for our patients, but we must also stand up for ourselves and each other. We cannot fix a broken healthcare system, nor can we hold a broken healthcare system together if we are broken. We must, as registered nurses, vote for the party that commits that they are going to address workload and staffing. As registered nurses, we must vote for the party that says they will make health and safety of our workplaces a priority. And we must vote for the party that will assure us and will work with us to ensure that when registered nurses leave their place of work, that they are proud of the care that they have given that day, and there are no tears in their eyes. Tomorrow, we're going to have a rally. Across the street from this hotel is a monument to Nurse Ethel Dickinson. 100 years ago, Ethel gave her life caring for patients with the Spanish flu. 1918, she died. Ethel was putting patients first 100 years ago, to a point where it took her own life. And registered nurses are continuing to put patients first today. So tomorrow we will rally in Harborside Park. And it just so happens that Harborside Park is right next to the building where Ethel nursed her patients and she died. This week we're going to send a message that we're not going to back away from our calls for safe staffing. We might have heard the minister this morning not give a whole lot of straight answers. Well, we'll keep pushing until we get the answer that we know registered nurses need and we know our healthcare system needs. Safe staffing needs to happen. It absolutely needs to happen. Our patients need change now. We can't wait. Registered nurses can't wait. You know, I'm motivated by your stories. It breaks my heart to hear your stories, the stories of frustration, and the stories of desperation, and sometimes even the stories of fear. Fear for your patients in terms of missing something or not being able to be there when something goes wrong, and you know what that means for your patient if that happens. Stories about fear for yourself and your license. You became a registered nurse because you wanted to give good care. And you're fearful because your work environment is not allowing you to do that. But you know, I'm also so motivated by your victories. And there are so many of them. They might be small victories or big victories, but each and every one of them are important victories. And one thing I know is that you have a passion for your colleagues and for registered nursing, and you also have a passion for your union and standing up for what is right. Because if you didn't, you wouldn't be here today, taking part in this week, learning more, finding ways, more ways that we can work together to make a difference. And we have to keep up the fight. We must keep up the fight. Because together, we are making a difference. And this is our fight.